Is a Harvard professor who analyzes COVID-19 data and advises policymakers around the country, says here in Texas, we are not taking the virus as seriously as we should. Anastasia Bolton from our Techno station in Houston has more in this report.
Lots of infections ahead.
The director of Harvard's Global Health Institute, Dr. Ashish Jha, deals with science and numbers.
So just in that last 5-6 days, we have seen an increase, and nothing that has happened in the last week makes me think that that we have made the kind of changes we need to really bend this curve.
Meaning the death rate we have not seen increase will.
We are going to see increases in the number of people dying from this virus because death always lags hospitalizations by a couple of weeks.
Infections and hospitalizations have increased, and Texas is one of the national leaders in that trend.
Bars and restaurants move through those gates that the White House had set up much more quickly than the data would allow. So this is really a combination of poor policy making and poor communication that has landed Texas in the spot that it's in.
Misinformation, Dr. Jha says, has impacted how we as a country have dealt with COVID-19.
From, that this is nothing but the flu, to it's all going to go away in April or go away over the summer. It's a bit of a information warfare almost, it feels like at times. And trying to counter that misinformation is difficult.
Dr. Jha said every country that's been successful at fighting COVID-19 used a slightly different approach, except for one thing.
Other countries have taken it seriously and we have not. We still have plenty of time to catch up and get this virus under control before the fall, before we even start thinking about opening schools for the fall. But if we're going to continue the path that we're on right now, it's going to be very hard to open, and it's going to be very hard to avoid having hundreds of thousands of more Americans die.
That's what current statistics and science show this COVID-19 expert. I'm Anastasia Bolton.
Well, and that Harvard doctor also talked about what counties should do when it comes to their beaches, saying he disagrees with those who think the beaches should be closed. He says a better way would simply be to control the crowd size.
We have to make sure they don't get super crowded. But we think being outdoors is safer. I believe that very strongly. Being out in the sun is and with good airflow is better. Beaches should be relatively safe.
But he says if beaches get very crowded and large groups of people are congregating together, that's how it can spread. And he says it's what people do after their trip to the beach that is really making the difference, like going to restaurants and bars, where the chances of spreading that virus obviously increase.